another beautiful day that the Lord has given us to fight against maternal, fetal, and neonatal mortality. We are privileged to be with Dr. Kioko another time.
Thank you very much.
We are privileged. It's an honor once again to have you as we discuss antepartum hemorrhage. No, Daktari.
Yes.
Welcome.
Thank you very much for having me on the show once again. As always, it's a privilege to be with you and to be with our beautiful viewers this day as we try to highlight the various issues which might affect the outcomes in both fetal, maternal, and neonatal issues. Thank you very much for giving me the opportunity once again to be part of the team that is championing this very important sector.
Thank you. We are more privileged. Now, today I want us to discuss antepartum hemorrhage.
Yes. Thank you very much. It's antepartum hemorrhage is a big word, so it will be good if we broke it down a little bit.
Very good.
It's basically composed of 3 words. To say antepartum hemorrhage, the word anti means before. Okay, partum means birth. So, and hemorrhage means bleeding.
Bleeding.
So we are basically discussing bleeding from, the birth canal that occurs before delivery. And specifically by before delivery, we mean more specifically within what we call the 3rd trimester. That is around from 28 weeks to the time of birth, which is around 7 months. Because yes, we have other types of bleeding which occur in pregnancy before the 28 weeks, which are generally termed as abortions, because the babies lost during that time are not viable. But once it occurs for babies or for any pregnancy that is from 28 weeks beyond, all the way to the time of delivery, that is what we call antepartum hemorrhage, bleeding before birth of the baby.
Okay. Now, this bleeding is not normal.
It's not normal.
Because according to my understanding, there should be no bleeding before the baby is born. Now, what could be the causes of this bleeding?
Okay, now, usually before pregnancy, we know most patients or most mothers will get their monthly period, which actually ceases during once they get expectant. So any other bleeding that occurs during pregnancy, as you've rightly put it, is actually abnormal. So every bleeding that occurs once pregnancy is confirmed is a source of concern.
And specifically now, it's bleeding via the birth canal.
Yes, via the birth canal. Okay. And the various causes of this bleeding, one, we have certain things that put a mother who is pregnant at risk of bleeding. Okay. The first one is when you have maternal or the mother has hypertensive disease in pregnancy. That is, the blood pressures are high or they're elevated during pregnancy, will put her at risk of bleeding. The other thing is external forces. Any trauma, any injury that occurs to the mother, especially to the abdomen area or to the uterus, whether be it intentional or be it accidental, because remember there are issues of also domestic violence.
Sure.
That will put the mother at risk of bleeding. The other things which are also quite contributory in terms of the bleeding is when you have certain maternal behavioral conditions. I would say I'll call them behavioral because things like smoking, alcohol use, or use of certain other hard drugs such as cocaine would put also the mother at risk of getting bleeding before time. It's always important to classify or to look at this bleeding depending on where it's coming from. So you can have bleeding that is coming from within the uterus, that is from the placenta or what makes the baby. Remember, the placenta is what connects the baby to the mother. It's actually attached to the wall of the uterus. And
we call it the second mother to the baby.
The second mother to the baby, because it's the one that feeds the mother the baby while the mother has not seen the baby, and it nurses that baby. So this uterus is attached to the wall this placenta is attached to the wall
the uterus,
and is connected to the baby through something called an umbilical cord. It's a cord per se, the way you would have a cord to your TV or a cord to your radio, to your radio from the mains.
To your phone and a charger.
Yes, exactly. Even a phone on a charger. So the baby benefits directly from the mother through the umbilical cord. So there are certain conditions that this placenta being attached to the mother, or being attaching the baby to the mother, can affect or can cause the placenta to either detach or to be situated in a wrong place, and this can also put the mother or the mother at risk of bleeding before giving birth. So I would like to delve a bit deeper into that. And I'd like to talk about certain conditions which actually are the main causes of this bleeding.
Okay.
The first cause that we will look at is a condition in which the placenta is situated in an abnormal place.
No, when you say abnormal,
yes,
there must be normal.
Yes.
So there's the normal place where the placenta should be situated.
True. You're very right. Now, the placenta is situated, is the normal place of the placenta should be situated is usually in the above or the upper part of the placenta. So we can have a placenta that is actually, through some mechanisms, has become situated in the lower aspects of the uterus. That is very close to the birth canal. Okay.
Okay.
And what happens is, as the pregnancy continues, okay, this placenta,
as it grows,
yes, as it grows, and the uterus enlarges and the baby also enlarges and approaches the time to be born, this placenta has a tendency to bleed. It can bleed because of the very situation it is situated. The other cause, also that has a name, and it's called placenta previa. Previa meaning in front. So it is the placenta that is actually in front of the baby. Okay.
Okay. So kind of the baby is sitting on the placenta.
Yes.
Okay.
And this placenta as well, apart from the obvious risk of bleeding, it's situated in such a place that the baby is not able to descend and be born normally.
When that time comes?
Yes, when the time for birth comes.
Okay.
So you know the risk that comes with the placenta being born before the baby?
Of course.
So
definitely the baby will die.
Yes, so we will lose the baby. And also that puts the mother at risk of severe bleeding. The other condition that I'd like to discuss is a condition in which the placenta in a normal position, yes, be located in the upper aspect or the upper part of the uterus, but this placenta actually detaches from the wall of the uterus.
Okay.
Remember the uterus, or the womb, has a wall, and this placenta also is attached to that wall of the uterus.
Okay.
So that the mother is able to feed the baby. So what happens? So we have the placenta has detached from the
uterus.
Yes, itself. So we have bleeding that occurs.
And now it will bleed between the placenta and the wall.
And the wall of the uterus. Thank you. So we have accumulation of blood in that place. So that is called abruption. Abruption meaning to take off or to detach. Abruption of the placenta.
I think medicine has so many big words.
Yes, but
it's very simple meanings. I think, Doctor, we need to go for a break. When we come back, we'll know why would a normally located placenta bleed. Welcome back to our show. If you've just joined us, this is your show, your very best show, Golden Minute. Today we are discussing bleeding before delivery. Daktari, you told us the abruption.
Yes.
What would cause a normally located placenta to bleed?
Okay, so basically what we are discussing is the placenta that is normally attached to the uterine wall has actually given way or detached or disconnected from the uterine wall, and that has resulted in bleeding within that that space between the placenta and the uterine wall. So the various things that will put a mother at risk of such, a very common cause is hypertension in pregnancy. That is when you have the mother's blood pressures actually being very high in pregnancy, that is a common cause of that kind of scenario. The other common cause of that bleeding is when you have injury, trauma to the abdomen. Remember, any injury to the abdomen can actually cause the placenta to detach or to separate from the uterine wall, and that also will put the mother at increased bleeding. The other cause which would also cause the placenta to separate, in circumstances where you have a certain release of pressure from the uterus, like would happen either when you have delivery of a first twin, or when you have the membranes breaking and the water is breaking and draining out of the uterus. That sudden pressure can pull with it placenta and cause it to detach and cause bleeding. Now, there is another common cause as well of bleeding before pregnancy, which is rupture of the uterus. That is, the uterus can actually give way. Okay.
Now, not the placenta.
Not the placenta.
The uterus.
The uterus, being the house of the baby,
okay,
can actually give way in certain parts of it. So we have circumstances in which, either due to increased pressures or because of trauma, cause an injury, an accident, any hit to the abdomen, apart from it being able to cause the placenta to detach, it can also actually cause the uterus itself
to rupture. That would be more dangerous,
and that is very dangerous because of the amount of blood loss that can occur with that kind of scenario. The other kind of the other cause would be, there are circumstances in which, you remember we talked about the umbilical cord connecting the baby to the uterus, so sorry, to the placenta, and the placenta to the uterus. Now, there are certain circumstances in which the umbilical cord does not insert properly into the placenta. So it is very superficially, like on top, just it just inserts on top of, just attached right on top of the placenta. So this vessel,
so there's an abnormality.
Yes, it's an abnormality of attachment of the umbilical cord to the placenta. So what happens is, these babies have increased risk of bleeding from the umbilical cord at the point of attachment, because it can easily detach. It's not very well inserted into the placenta.
And it also has its veins.
Yes, because
and arteries.
The placenta, I mean, the umbilical cord has veins and arteries that feed, or blood vessels that feed the baby. So these ones can bleed, and actually this bleeding comes from the baby, not from the mother this time, because it is these vessels that are bleeding, these vessels that go to the baby.
To the baby.
Yes.
Okay.
So all these types of bleeding will be seen as the bleeding through the birth canal. Yes. They may or may not be noticeable as such. And this would bring me to a point where I'd like to probably discuss a little bit more on some differences between bleeding depending on the cause.
Please do.
When we have placenta previa, at the point at which the placenta is located at an abnormal place, the most common sign is a bleeding that is painless. So a patient will be, or a mother will be just all about her business, and she'll suddenly notice blood.
And there's no pain?
There's no pain. There's no abdominal pain. The baby is fine. You can feel the baby is kicking and all, but there's blood. Just because the placenta is located in such an area, it's very likely easily to bleed without affecting the rest of the uterus. So this will give painless bleeding. Now, the other thing is, this bleeding is very bright red. It's blood that is freshly bleeding. So it's actually bright red
fresh blood.
Fresh blood, painless. And most of the time, unless the bleeding is severe, the baby will most of the times be fine. Because the placenta,
depending on the amount lost.
Yes, the placenta is basically attached. That's it's in the wrong place. So the blood will easily flow into the birth canal. We have abruption of the placenta, where if the placenta separates, that space that the placenta leaves between it and the uterus, depending on the amount of separation, there can be accumulation of a lot of blood in that space.
So it's not leaking out?
Yes, before it actually leaks out through the birth canal. So the biggest challenge with this is that we can have a very big amount of blood lost before we actually notice the bleeding. And this also puts the mother at great risk.
Now, that means the mother will be thinking all is all right.
All is fine.
But she's bleeding.
But she's bleeding.
Okay.
Because the place where that bleeding is happening is concealed, it's hidden. So the other bad thing, or the other big risk with the bleeding that happens once the placenta abrupts, or once the placenta detaches, is that, remember, the placenta feeds the baby. So
Sure.
the baby will not be getting any supply from the mother because she has been separated. So we, most of the time, unfortunately, end up losing these babies.
Unlike in Previa.
Unlike in Previa, where the baby is still attached, just that the placenta is in the wrong place. So when we are able, once the mother is able, it will be difficult also for the mother to, you know, tell this unless she explains it to the clinician. But it would be good to sound this early and to say that any kind of bleeding that occurs through the birth canal during pregnancy is not normal. I think we'll insist that over and over again, and should be a sign for this mother to seek urgent medical attention. There are other causes of bleeding which now do not occur really inside the uterus, but would also, you know, would be a cause of concern, because remember, this mother needs this blood and
for herself, for her baby,
and for the baby, because the blood is what goes round and also nourishes the baby as the baby continues to grow.
It's basically their life.
Exactly. So it's their fuel, so to speak. So if the mother loses so much blood, again, the outcomes of the baby
is
not
affected.
be as good. Okay. So in this scenario, we have scenarios in which we have bleeding from what is called the cervix. The cervix is like the gateway into the womb. So if you have bleeding from the cervix, either caused by certain conditions such as cancer, or cancer of the cervix, we have certain abnormal growths known as polyps, or any even trauma, even any injury or laceration or any kind of injury to the cervix,
itself,
or even to the birth canal will cause bleeding, of course. So all these are concerns for us, for the clinician, because it affects the outcomes of the mother and the baby in case there's massive blood loss.
Thank you very much, Daktari. We will go for a break, but when we come back, we will know now what are the dangers of bleeding, both to the mother and to the baby. It's a pleasure knowing that you're still together with us. Now, Dr. Kioko, before we discuss the dangers of bleeding, both to the mother and the baby, please let us discuss first the clinical presentation of this mother who is bleeding.
Okay, so the most common signs that, or the most common thing that this mother will describe is blood, basically from the birth canal. So the amount of bleeding would vary depending on
where the bleeding is occurring.
Exactly. So the mother could have massive bleeding. She would report a lot of bleeding from the birth canal, probably, you know, continuous, and she would report either having pain or not having pain. So it will be an important thing to find out from the mother whether she has pain or she doesn't.
Again, this will depend with where the bleeding is happening.
Exactly. Or what is the cause of the bleeding. So from that as well, so we have massive bleeding from the birth canal. Then the other common presentation, or what will be a common presentation, will be that sometimes the mothers would come when the bleeding is actually very severe, in what we call shock. Okay, meaning the mother has lost so much blood that we are in a situation where if we have further loss of blood, could actually endanger this mother's life. Already the shock itself is quite a danger to the mother's life. So once the patient comes to the hospital, so the clinician is able to assess, especially, and find out how much blood loss is there, and have at the back of their minds a possible cause of the bleeding. Yes.
What about when the blood is concealed? How will you tell the amount lost?
Well, it's a bit difficult. The good thing is the clinician is able to look at how the general condition of the mother. Because remember, we also do our baseline, what we call the baseline not really the observations of the patient. So if a patient has had very little bleeding, but you find that this patient is actually restless or has the blood pressures are quite lower than you would expect.
It will be signs of more bleeding.
Yeah, it will show that probably there's bleeding somewhere else that is not actually being seen outside. So that would put us at a high alert for another cause of bleeding. The other thing which we do commonly is we investigate these patients. So in case we have a bleeding and we are not able to tell the exact cause, we have various ways of telling, and the best or the most available way is to do a scan. That is what we call an ultrasound scan of the uterus and the organs and the baby. So we are able to tell where the position of the placenta and whether the placenta is still attached to the abdomen or to the uterus, and to tell whether it is the most likely cause of the bleeding.
Now, could you please discuss the dangers?
Yes. Once a mother bleeds, there are dangers that are what we call acute. They happen there and then to the mother. So this mother, just like any other sort of bleeding that would happen anywhere in the body, bleeding from the birth canal during pregnancy is a serious cause of maternal death or maternal illness in the long run. So this mother will lose blood in the acute setting, in the near setting, and she'll go into what we call shock, meaning the body does not have enough blood to sustain its function, which eventually leads to damage to organs. The kidney gets damaged, the brain gets damaged, and we get to lose the mother. The other thing is we have risks of bleeding to the fetus, because remember, the fetus also benefits from the same blood. So if this blood is not sufficient, also the fetus will get compromised. So in the acute setting, that is within that period of bleeding, you could have loss of the fetus because the fetus does not get enough blood, especially in terms of where the placenta has separated and it's not sufficient enough to feed the baby. The other long-term effects is once you have a bleed, sometimes you'd have a bleed that occurs and actually it doesn't lead to delivery of the baby, but this mother will get low blood levels because of the initial bleed, what we call anemia. And what we have, anemia is basically low blood levels. So these low blood levels contribute to a poor development of the baby. So you would have a baby who is born with low low birth weight, even if they are term. Would have mothers who are weak and who are basically, it affects the general wellness of both the mother and the baby in the long run.
Please tell me, are there more dangers after the mother delivers, if there are chances that this mother will go to term and deliver?
Yes, exactly. And what happens is that this mother, once she delivers, because either of what we call postpartum hemorrhage, that is, the mother is still at risk of bleeding even after.
She's now not pregnant.
Yes.
She's already delivered, but she's at risk of bleeding.
Exactly, even after delivery. Because you might have issues with the contraction of the uterus, and remember, even the places where the placenta was attached, that bleeding would continue on and on even after the mother delivers and even after the placenta is delivered. So she's at risk of getting hemorrhage after delivery,
which is now more risk to her life still.
And another, actually the leading cause of maternal deaths in the country is actually that.
Now postpartum.
Yes.
Now let's manage this mother who comes to hospital and she's bleeding.
Yes.
What would she expect?
So any bleeding, again I'll insist for probably the nth time, that any bleeding is not normal and will necessitate prompt medical attention in a hospital. So this mother comes to hospital, so she is seen by the clinician who gets her signs from the beginning. So she'll give the history on how and when the bleeding started, and the clinician will try as much to estimate how much blood has been lost and assess the condition of this mother. So our major aim as clinicians is to have both favorable outcomes for the mother
And the baby.
And the baby. And I should be quick to add that it's not always possible. Okay.
In this case.
In this scenario, because sometimes you would find in situations where you find a mother who's already come too late, or probably who had bleeding that was concealed, you might actually lose one or both of them, unfortunately. However, in this situation, our best aim is to stabilize the mother and the baby. So this mother has lost blood, or is losing blood. So our first aim is to try to stabilize, the condition of this mother by either giving this mother what we call fluids, basically fluids to help to resuscitate, to bring up the volume of the blood, or we also take blood, and also we add blood to the mother.
Transfusion.
That's called transfusion, to maintain, the circulating level of blood. Now, in terms of what we call definitive management, that is managing the cause of the bleeding. Now that will be wholly dependent on what it is,
on the cause
itself. So in cases of probably where the placenta is wrongly placed and it is bleeding, we sometimes observe if the bleeding is not as much and does not put the mother's life at risk and the mother is not in danger, we actually can put the patient on bed rest and observe this patient. That is in a situation where we hope there will be no rebleed from the placenta.
Let me ask you the last question.
Okay.
What if the bleeding is because of a uterine rupture?
Yes. So in cases where it's either uterine rupture, or even sometimes even the abruption of the placenta, or when you have bleeding that continues, even if it's placenta previa or of whatever cause, our best aim is to actually go to the source of bleeding, that is operatively. So this mother will be taken to theater and she'll be operated on, because remember, we cannot,
regardless now of the gestation of the baby.
It doesn't matter, because what is more important is not to lose this mother, and the fetal or the outcome of the baby sometimes will not be as good if the mother is at risk herself.
Sure.
So we want to, as much as possible, ensure the safety of this mother. So we will take her to theater. That's what mostly happens, and we take her to theater and try to seal wherever it is that is bleeding. We try to seal the bleeding. If it is the placenta that is bleeding, either at a place that has detached or it's bleeding because it's in a wrong area, we are able to deliver the baby regardless of the gestation and remove the placenta. Because once you remove the placenta, now the uterus has a way of contracting and reducing the bleeding. It is also important to note that, not in terms of bleeding as I described earlier, you would have a situation where you can give a bit more time for the baby to mature. And I described placenta previa, in which you can give the mother bed rest. You can give medications to mature the baby, just in case anticipating any other bleed. Now you're able to deliver the baby. So you will deliver the baby depending on the method of delivery will depend on how severe what we call the placenta previa is. If it covers the entire, because the placenta is a bit low, it's low lying, it's in front of the baby. So if it covers the entire birth canal, you will not be able to deliver that baby normally. So we'll have to opt for an operative delivery.
So in operative management, the baby has to come out.
The baby has to come out.
So that the bleeding area can be sealed.
Exactly.
I think we will have to end it there. But I'm already enjoying the discussion. I wish we could be able to continue further.
Exactly.
But I think one day we'll come back and pick from here, continue to the end, because I believe there's so much that we have not discussed. From us here in Golden Minute Show, I remain your show host, Anne B, as we continue fighting against maternal, fetal, and neonatal mortality. Until we meet again, shalom.